Hi everyone, I'm Diasha, a MBBS final year student, and today I came up with a medicine hot topic, that is COPD. So this video I'm gonna explain the updated management of COPD, that is chronic obstructive pulmonary disease. And if you students want a detailed video on COPD and its characteristics, then please write it down in the comment box. And if you people like the video and if the video was helpful, then please like, share and comment. Thank you. So before we start with the treatment, we're gonna study about mMRC grading, which is a very important topic. So what is mMRC? It's Modified Medical Research Council, that is Modified Medical Research Council. Okay, so in mMRC grading, we can grade mMRC grades into 4 grades, and this is the grading for dyspnea. So let's grade it. Grade 1, grade 2, grade 3, and grade 4. So let's start with grade 1. In grade 1, when a person goes into inclined places, for example, taking staircases, the breathlessness aggregates. Okay, so the dyspnea aggregates. Okay, coming into the grade 2, what we see is a person walking slower than a person of the same age. So this is grade 2. What we see in grade 3 is stop intermittently after even a few steps, like taking few steps and then stops due to the aggravation of the dyspnea, and then again it relieves, and then he or she again starts walking, and then again he feels this dyspnea and again he stops. So this is how grade 3 is explained. And grade 4 is the person is always breathless. He can't even wake up from his bed and go outside, or even he can't even make his dress himself up because he feels dyspneic whenever he wakes up from the bed and try to do something, or even dressing up him or herself, he feels dyspneic. So these are the 4 grades. So as we learn about the 4 grades, I will start to talk about the COPD Severity Index, which is also an important topic to know how the treatment should be according to the index. So let's start with COPD Severity Index. So there are 2 parts in it. One is low risk and one is high risk. So in case of low risk mMRC, grading will be around 0 to 1, but in high risk the mMRC grading will be greater than or equals to 2. So, and also in low risk there will be no exacerbation or maybe a single exacerbation, but there was no requirement of hospitalization. But in case of high risk, there is more than 2 exacerbations recently, or there is hospitalization at least once. So we grade the severity into 4 parts, that is A, B, C, D. A is known as low risk, low symptoms. B is low risk, high symptoms. C is high risk, low symptoms. D is high risk, high symptoms. So let me write it down. Okay, so there are 2 parts, risk and symptoms. So if we say high risk, it means patient has had hospitalization, and if we say high symptoms, means mMRC grade more than 2. So in case of A, it's low risk, low symptoms, so no hospitalization in the recent 6 months to 1 year. Okay, we can grade it grade 0 to 1. And then we are coming to B, low risk, high symptoms. There is no hospitalization in these 6 months but there is a high mMRC grade. As we say high symptoms, I said high symptoms means mMRC grade more than 2. And then comes grade C. So in C we see high risk. There means there is hospitalization. So recently one's hospitalization, but as I said low symptoms, there means low mMRC grading. Now in D, there are both things, high risk and high symptoms. So there is hospitalization recently and there is high mMRC grading. In this case, mMRC grading is more than equals to 2. So this is the thing. And as we read about grading, mMRC grading, and then we come up on the COPD Severity Index. Now we are ready to know about the treatments. So I said according to the COPD Severity Index, we will be differentiating the treatment procedures. So in each case, as I said, A, B, C, D in the COPD Severity Index. So each of these parameters will have different kind of different level of treatment rather. Okay. So in case of A, COPD Severity Index, we will have to give bronchodilators. So what kind of bronchodilators? We don't use short-acting beta-2 agonist. We use here is long-acting beta-2 agonist. We use long-acting beta-2 agonist. We call it LABA in short. Okay, example of LABA, we can give salmeterol. Okay, this is the part of A, COPD Severity Index. Now we are coming to B, when it is low risk and high symptoms. In A it was low risk, low symptoms. In B it's low risk, high symptoms. So in this case we're gonna give them long-acting beta-2 agonist, or we can give LABA or LAMA. LAMA is long-acting muscarinic antagonist. We can give either this, or if it fails, then we can give a mixture of both. That is LABA plus LAMA. Okay, now if it's C, COPD Severity Index, then we need to give LABA plus LAMA plus ICS, that is inhaled corticosteroids. So in C we are having high risk and low symptoms, so we'll give LABA, that is long-acting beta-2 agonist, plus LAMA, that is long-acting muscarinic antagonist, plus ICS, that is inhaled corticosteroids. So, example of ICS, we can give budesonide or formoterol. In example of LAMA, we can give tiotropium. Okay, now coming to the last part, that is high risk, high symptoms. This is the most serious case, so we're gonna give LABA plus LAMA plus ICS plus roflumilast, which is an example of phosphodiesterase 4 inhibitor. So roflumilast is phosphodiesterase 4 inhibitor. So what is the main role of steroids, inhaled corticosteroids out here, is to reduce exacerbations. In case of exacerbations, we can add oral steroids, and the main thing which reduces mortality rate in case of exacerbations is low dose oxygen supply. So what is the role of this low dose oxygen supply is it increases the dissolved oxygen inside your body, and it increases work capacity of the patient. So low dose oxygen supply is a very important thing in case of COPD, in case of COPD treatment. That's it. So that's it for today. I hope this video was helpful for you people. Please comment in the comment box that it was helpful or not, and whether I have missed something, or if you want a detailed video on COPD diagnosis, management, and characteristics. So this is all for today. Thank you so much.